Hi, my name is Karen Nonu, and this is learning teaching number 3. And sorry for looking horrible, but I'm just getting over having surgery. So, anyway. So I'm going to go through my questions, and there you go. So the first question was, in a nutshell, what is the basic purpose or goal of the article from Myers-Walls? And I put that this paper is to examine the role of a family life educator and to evaluate whether it is working or not. There was a model set up to differentiate between a family life educator and family therapy. Doherty created a model that helped family life educators avoid bleeding over the line into family therapy. But students stated that the model doesn't give a complete description of family life educators, nor does it identify the boundaries and differentiate what they seek. Number 2 was, what concerns do Myers-Walls have with Doherty's model? Do you agree or disagree with these concerns, and why? The concerns centered around 3 areas. Number 1 was it conceptualizes family life educator and family therapy in a hierarchical relationship. The LFI model is comprised of 5 levels, and only 3 of the levels are appropriate for family life educators. Advanced family life educators, professionals can move into levels 4 and 5. Family therapists are able to do everything because clients know that when they see a therapist, they're not in an educational program. Also, dealing with feelings and support is a higher order professional skill. Number 2, it presents the description of family life educators that is inconsistent with the established definition. FLE is defined as a certification program for FLE, which includes prevention and education for individuals and families. And number 3, it distinguishes between FLE and FT using superficial and sometimes inaccurate criteria. The content areas overlap, and that can be confusing. So in reference to number 1, my opinion is that family life educators shouldn't be able to do all steps. When clients seek help from a therapist, they want to know that the person they are seeing has the education needed to give them adequate advice and help. They shouldn't have to wonder if the person is still in school. In reference to number 2, I think the definition is sufficient for family life educators. That is their role. We do provide prevention and education for families and individuals. In reference to number 3, I agree that if the content areas overlap, that can be inconsistent. We need to be very clear in what our roles are, and as a family life educator, I should not be doing anything that would require a family therapist to do. I don't have the schooling for that. So the next one is, what is your role and responsibilities in working with families as family life educator? If you had to choose 3 words that best describe the role of family life educator, what would that be? My role is to provide information regarding specific subjects. And that includes prevention and education for individuals and families. The 3 words that I came up with was instructor, supporter, and informative. The next one was, what types of services are you most qualified to provide for families as a family life educator, family therapist, or an FCM? Family case manager. FLE, I came up with parenting classes, instructor, or a youth mentor. Family therapist could be a child therapist or a family therapist. FCM could be a social worker or a field caseworker. And field caseworkers that go out into the field and investigate children or families that are involved in some kind of abuse or neglect. The next one is, why is it so important that whatever our training is, we understand our limits and boundaries when working with families? Unless we are licensed and have the correct schooling, we have no place to treat and give advice to families. Families and individuals have the right to be treated by someone who is equipped, prepared, and trained to give you the right information that can help your life situation. If you are not licensed or have the education necessary, you can help the individual or family by providing information as long as you aren't treating or giving advice. If you don't follow these strict lines, you could be breaking the law. And then for the last one is, does the Myers-Wall article help you to see why it is so important as a family life educator to not slide into the role of counselor therapist? And explain your thoughts. It really did help me understand where the lines are drawn. It helps me to understand how important it is for me to finish my education so that I can learn those things that I need to know and have to know in order to be prepared, in my case, to be a social worker. Family life educators are not trained to be giving advice or to treat individuals, and so they shouldn't be blurring those lines. We need to make sure that we are very clear with what our roles are so that we don't put individuals' health and safety at risk. Hope that helps, and hope I did a good job, and thanks so much.